Hi, I'm Dr. Julie Steinauer, and this is a segment of Ask Dr. Julie. So, on the segment of Ask Dr. Julie, I have a question that I hear a lot. People always want to know, with respect, Dr. Steinauer, why are you still wearing glasses? Well, let me tell you why. I think I've done this before, but it's always a good topic to bring up and come around with. I actually have decreased my prescription a lot. I'm nearsighted or I have myopia, which means that I need a lens to be able to see things more clear and distinct at distance. In fact, my lens has to kind of minify or make things look smaller because I'm so nearsighted that things look big and blobby at a distance without my glasses. But over the years, I've really worked hard to decrease my lens prescription, and I've done quite a lot in that effort. So how much and how often do I work on it? To be honest, I'm a really bad patient. I put more of my time, energy, and effort in helping the individuals who connect with us at our office with their vision than I do my own. However, I have been over the last couple of years working pretty significantly and seriously on decreasing my lens prescription. Sort of. I'm just being honest. I don't always have the time to do that because, again, I'm working with tons of patients here at our clinic, managing an office, managing a home, taking care of my kids. Man, oh boy, I better not say managing my husband. Loving my husband. There's so many things that I'm involved with. And you know, sometimes our vision, my vision, is low on the totem pole to helping everybody else. So I'll admit that fault. But I have decreased my lens prescription. I am by nature asymmetric, which means that this eye actually sees better and has less power in it than my left eye does. And once upon a time, a long time ago, when doctors prescribed glasses for me, they didn't figure out the reason why my development of lenses was asymmetric was because I was laying in bed reading at night on my side. And I tended to lay on my left side, which made my left eye have to focus harder. What that means is that my left eye having to focus harder developed more nearsightedness than my right eye did. No one ever figured that out. But it's definitely something that I look for now with my patients. And it's something that I tell you to look for. If you've got, you do it yourself or your kids tend to lay on the couch even to watch TV or to read or to play video games. Stop it. Just stop. Don't do it anymore. Position them and yourself straight on with what you're doing so that you don't become asymmetric. So I'm asymmetric, and I've had to try to do a lot of things to try and make it balanced, which is what we believe in here at Vision for Life, is balancing a lens prescription so it's fairly equivalent between the two eyes, fairly symmetrical if we can get that. Now, over time, I've decreased my lens prescription by about 40%. That's no small feat. Now, I know that if I actually did vision therapy and Syntonics again, because I have done them in the past, but if I did them again, I'd probably be able to reduce my lens prescription yet again. And that's probably something in my future, but I'll be honest, right now, we have the most overwhelming response of people contacting our clinic than what I have ever before experienced in all of my 19, almost 20 years of being a doctor. Wow, I almost got to say 20 years. It'll be 20 years towards summertime this year. I don't feel like I should be saying that I've been doing this for 20 years, but I have. And so we've had so much overwhelming response. We've been really, truly blessed. We're processing over, depends monthly, but anywhere from 150 to over 200 requests for information about possibly becoming a patient of ours. And there's not time right now, as I'm putting systems in place to help me be able to manage the growth of our business. Again, we're super fortunate, super blessed. And so one of these days, I promise, I'll get back to that again, but I still decreased my lens prescription by quite a bit last year, just following some of the principles I know about it, even though I hadn't been actively working on it through vision therapy or Syntonics, which, by the way, that's the best method. We typically see about a 30% reduction in myopia and anywhere up to about a 50% reduction in astigmatism. Hyperopia, we can do a whole lot more. So it might be more like 80-90% can be reduced if someone is farsighted. I hope this was good information. If it was, like our video, subscribe to our channel so that you can get more information like this from me. And if you've not done so already and you want to be part of our mailing list for blogs and stuff that goes out, then there's probably some links down here under this video somewhere that you can click on and become subscribed to our email list. Thank you.